This is going to go through similar breathing strategies that I show in other videos, but it's going to be specific for someone who has their pelvis really kicked out to one side, right? And with this kick of the pelvis, we may also see some movement through the ribs and trunk. As I'm trying to pull my hips back underneath me, my tendency is going to want to be to tip my shoulders towards that side. So I use something to try and keep my upper body up nice and tall while I try and pull my pelvis underneath me. So facing a counter, I can either put a stack of books over here, or I could put a cane or a post or something stick-like, right? So if I have someone that has this shift of their pelvis to one side, for me it's my left, and maybe I'll even see some prominence in the ribs in the back on the right side, this is a nice way to try and correct that position. So I'm going to have a stick, a cane, a post of some kind, right, baseball bat, and I'm going to have one hand on the counter and one hand up as high as I can, comfortably, right? Now, if I start off like this, first I want to think about trying to pull my hips underneath me, so I'm bearing weight equally through my feet. I want to make sure my butt's not behind me, so I want to feel like my hips are underneath me, right? And if you look at my lower back, I want to try and check to see, is my back arched, or can I lightly pull my butt underneath me? So really trying to center my pelvis underneath my upper body so I have equal weight on both feet, right? So this hand up here is kind of stopping me, so as I pull my hips underneath, I'm not going to shift towards this side. I'm going to use this hand to kind of continue to pull my trunk up nice and tall. So I'm standing tall in this position. I have a little bit of downward pressure through this cane, like I'm trying to drive it down to the counter. And I want to make sure that as I do light breathing, my shoulders are staying down. Ideally, maybe I'm in a dresser where I have a mirror in front of me. And I'm just trying to do light, normal breathing with any activity, hiking my shoulders up towards my ears. And I'm especially trying to make sure that I'm not letting my pelvis kick to the side and I'm not letting my body tip. So I'm really using this post, right, to pull me up tall, pull my shoulder down away from my ear, and just breathe normally. And then as breathing normally is going okay, I'll gradually try and increase the length of my inhale, trying to focus on that coming from the lower aspect of my rib cage and trunk, really watching in the mirror to make sure, especially as I inhale more, there's none of this. Just light, controlled breathing. And I try to do this for gradually longer periods of time. Maybe the first time you do it for 30 seconds. Maybe you try and work up to a minute, 2 minutes, trying to work on stabilizing your body in this corrected posture that's a little bit more of a straight position versus being shifted to one side.